crucial health care program for children is running out of money nationwide. You might have heard federal funding for CHIP, which is a children's health insurance program, is dwindling fast.
And with no long-term plan in place to extend the program, families are now wondering what's next and how will they afford health care for their kids. KREM 2's Alexa Block looked into what options families have now if CHIP fades away.
We're talking about health care that covers about 9 million children from lower income households in the U.S. These are families that make too much money to qualify for Medicaid. There are 22,000 kids in Idaho on CHIP and close to 60,000 in Washington. A spokesperson with the Washington State Health Care Authority says they have funding to continue the program through the end of February. The Idaho Department of Health and Welfare says they've got enough money to get them through March. Now, I found out this afternoon that those most impacted by this are children who need it the most. CHIP is federally funded but administered by each individual state. Right now, families enrolled in CHIP pay a premium of $20 to $30 a month for each child. No deductibles or co-pays. The federal funding for the program began drying up back in October. Congress pumped $2.85 billion into the program in December to temporarily extend it through March. But some states could run out of money sooner. Better Health Together helps people sign up for programs like CHIP. Curtis Fackler, Navigator Program Manager for Better Health Together, says Washington families could end up paying more for health insurance if CHIP isn't re-upped. He says one option is parents could enroll their kids on their own health care plans.
The problem with that is a lot of companies now do not pay for dependent coverage. So it's not uncommon to see it be $150 or $200 per child for coverage.
The family wouldn't be eligible for tax credits. Another option could be if parents have insurance through the exchange and are getting tax credits, they could add their children to their policies. The out-of-pocket costs would not change because the child's premiums will be paid for through tax credits. They'll also have to pay for co-pays and deductibles.
But if you have a child that say they're asthmatic or they have other health issues and they're going to the doctor all the time, this could be really hardship on those families.
In Idaho, both of these options are also available, but it may not be necessary in Washington or Idaho. Both states are required by law to provide health insurance to low-income children. If Congress doesn't continue CHIP funding, the states will have to take over and find a way to get the money. Now, officials with the Idaho Department of Health and Welfare and officials with the Washington State Health Care Authority say they are working with state and federal lawmakers. They plan on doing everything they can to make sure that CHIP is reauthorized by Congress. In the studio tonight, Alexa Block, KREM 2 News.